Before giving Rituximab, don't think of it as just another immunosuppressant. Think of it as a high-impact anti-CD20 drug, where the safety checklist matters as much as the indication. Rituximab targets CD20-positive B cells and depletes them. That is why it helps in B-cell malignancies and antibody-mediated autoimmune disease. Plasma cells are relatively spared, so antibody levels may not fall immediately, and clinical response depends on the disease. Its approved uses include non-Hodgkin lymphoma, CLL, rheumatoid arthritis, ANKA-associated vasculitis, and pemphigus vulgaris. It is also used off-label in selected diseases like lupus nephritis, ITP, autoimmune hemolytic anemia, membranous nephropathy, and some neuroimmunology disorders. But remember the important correction. Rituximab is not FDA approved for lupus nephritis. The dose is not one size fits all. It depends on the disease and protocol. You may see 375 milligrams per square meter weekly for 4 weeks, or 1 gram on day 1 and day 15. Maintenance is disease-specific, so always check the indication-specific regimen. Before the infusion, pause and run the checklist. CBC and platelets, HB's antigen and anti-HBC, liver and renal function, pregnancy status when relevant, active infection screen, vaccine review, and baseline IgG in selected patients. The must-not-miss step is hepatitis B screening. Hepatitis B is the classic trap. HB's antigen-positive patients are at risk, but anti-HBC positivity also matters, even when HB's antigen is negative. Resolved hepatitis B can still reactivate. Also review vaccines before treatment, because vaccine response becomes weaker after B-cell depletion. Give non-live vaccines before therapy when possible, and avoid live vaccines during treatment. The first infusion is the highest risk infusion, so monitor closely for fever, rigors, hypotension, bronchospasm, and anaphylaxis. After that, remember the serious delayed risks: infection, HBV reactivation, PML, late neutropenia, and hypogammaglobulinemia. New neurological symptoms after rituximab should always raise concern for PML. So the final memory checklist is simple: B cells, HBV, vaccines, infection risk, infusion reaction, PML, CBC, IgG, and PJP prophylaxis only if the patient is high risk. Rituximab is powerful, but safe use depends on careful screening before treatment and proper follow-up after.